Good afternoon. Thank you so much for being here this evening. This is one of two sessions. We are also recording this as well. Welcome back Alex from USI, explaining more with the insurance that we have or going into. So I'm going to turn it right over to Alex and Eric as well here. So without further ado.
Yep, thank you. Good afternoon, everyone. I do plan on keeping this relatively short, maybe 30 to 45 minutes, so we'll have plenty of questions. Please stop me along the way if you have any questions. Eric and I will also stick around for a few minutes after the presentation. If maybe you have some personal questions that you don't feel comfortable bringing up in front of the group, we'll stick around and stay as long as we need to. This presentation is going to look and feel a lot like the presentation that I did just about a month and a half ago as school was getting ready to kick off. However, there have been some what I would call positive developments around the program that I think will help a lot of you with some of the concerns that you brought up around some of the programs that we were implementing. So first, with Network Health and Family Savings Plan, I know that we had asked all of you who were eligible to participate in this program to meet with a Network Health representative, so you all are probably very familiar with it. However, I want to go through it very briefly because one, there may be a potential development that I want you all to be aware of, but two, just to make sure that you're aware of the program just in case any of your circumstances change. Maybe your spouse gets a new job and you may be eligible for this benefit, to keep it in the back of your head throughout the year, because otherwise you probably likely won't hear from us again until about this time next year. So the Family Savings Plan benefit is a benefit to you if you have access to another group-sponsored health plan. So whether you're under the age of 26 and you're still eligible to be on your parents' plan, or whether you have a second job, which I doubt all of you are working full-time elsewhere, but if you are, that would be an opportunity. Or obviously if you're married and your spouse has access to another employer-sponsored group health plan, you can receive up to 100% reimbursement for all of your out-of-pocket costs. So that includes your deductible, co-insurance, and co-pays. So anything that you pay for those services under that plan, you would be eligible for reimbursement under the Family Savings Plan. So again, this is a quick slide on determining eligibility. Do you have access to another employer's plan? If you do, yes, you would be eligible. One thing that I do want to point out is that not your entire family needs to go for you to qualify for this benefit. So one example may be my spouse's employer has a spousal carve-out. So I would not be eligible to go on my wife's health plan. However, if my wife and my children went, they would still be eligible for the Family Savings Plan. So it's not all or nothing. It's if anybody is eligible to go on to that employer-sponsored health plan, they would be eligible for reimbursement. So again, how does it work? You join that other group-sponsored health plan. You would pay the premium to be on that health plan, likely through your spouse's or maybe your parents' premium deduction. This is the thing that may be changing, that may be a really big deal. So currently today, I know one of the main complaints about this program is Network Health was requiring you to use a Network Health provider system, Freighter, Children's, or Ascension. That is potentially, and I want to stress the word potentially, changing where there will no longer be any provider requirements. So you could go to Aurora, you could go to ThedaCare, any provider that you may be going. So please, I'm going to let Maria and Matt know as soon as I get final confirmation on that. But if you're currently going to an Aurora doctor and this has, kept you from taking advantage of this program, please watch for confirmation in the coming days and weeks on whether that requirement, that network access requirement, will be going away. So that could be an additional opportunity for you as you're considering your open enrollment options. There is also this monthly premium incentive. So sometimes another barrier to taking advantage of this plan is maybe my spouse's plan costs a lot more. Well, the district will also give a $150 monthly benefit to help cover any premium differential that there may be in order to take advantage of this program. So again, be aware of that. Family Savings Plan is out there. There's all these slides on how to access it. One thing that I do want to remind you all, whether you're on the program today or you're moving to the program for January 1st, is you will be getting a Network Health ID card. If you present that ID card as secondary insurance to the doctor that you're going to see, they should be able to bill Network Health directly, which means you don't need to file a claim. It's not always the cleanest, and a lot of times, or sometimes I should say, the person who's taking your ID card may not understand what it is. But if you kind of explain the program as secondary insurance, they should be able to bill Network Health directly, and you should get your reimbursement without having to file an actual claim. Again, trying to clean up that process as best as we can. Any questions on the family savings plan? Okay, a couple of compliancy type issues. If the health plan that you're moving to is a high deductible health plan with a health savings account, please note that you cannot contribute to an HSA under that plan. This really matters if the employer gives an HSA contribution. Okay, you would need to let that employer know to please do not give you an HSA contribution for that health plan, because you would be in violation of IRS regulations because you're getting first dollar coverage through the reimbursement program. So, if your spouse's plan only offers a high deductible health plan with an HSA, please note that you cannot contribute to that HSA in order to get access to this benefit. If you do have any questions in this PowerPoint, there are you can either call Network Health to enroll or ask questions. You can also shoot an email, and then Catalyze Health, which is the program that is kind of the backroom administrator of this, you can contact them as well. And I see some people taking pictures of the presentation. Maria will have all of this, as will Kim in the office, so we can make sure this gets out. Before I move on, any questions on family savings plan? Okay. Moving on to the medical plan here through the district. As a reminder, we are making some plan design changes. So today your deductible is currently $500 single and $1,000 family. That is moving to $2,000 single, $4,000 family. And the co-insurance is increasing from 5% up to 10%. And the deductible change, we're going to talk a lot about Garner in just a moment, but you can be reimbursed that entire deductible amount through that Garner program. So what we're trying to do and what we are trying to accomplish through this process is how do we control costs but offer you a better benefit. And that's where Garner is going to come in and what we were trying to do there. So other than those two changes, everything else remained the same. So your office visit copay stayed the same. The emergency room copay stayed the same. So really the major change was the deductible, and then we increased the co-insurance to get in line with market norms. I mentioned Garner. If you remember from last month, Garner is the new mobile app that will allow you to log on and search for providers and find the best performing doctors within your network. So again, what we're trying to do is give you all access and data to finding the best providers within your network. So just to reiterate what we went through 6 weeks ago, these different hospitals all have different surgical site infection rates after colon surgery. But if you look on the right, all these colors match to this hospital. It varies depending on which doctor you go see. So we're no longer in the game of picking Aurora versus Freighter or Ascension. What we're really trying to do is give you all information so that you can make good decisions on which actual doctors you go and see so that you can get the best outcomes, because we all want you to be healthy. And when you have better health outcomes, the district saves money. And quite frankly, so do you. How does Garner identify those top providers? They have over 310 million unique patients that are represented with over 60 billion medical records. They get that data from Medicare and Medicaid, employers, unique third-party relationships, clearinghouses, insurance companies, including United Healthcare and Anthem, the two largest insurance companies in the country. So this is all data-driven decisions. It's not who gets the best kickbacks or things like that. It really is looking at actual claims outcomes from the population across the country. So I mentioned the mobile app. One thing that came out of our conversation in September was the frustration that we weren't going to be able to find providers until closer to December. I am happy to tell all of you that the Garner app is live as of this moment. So you can go on to the Apple Store, the App Store, or if you have a Google phone, is it Chrome? What is it called?
I'm not sure.
Yeah, sorry. Google, the Google Store. and download the Garner app. What you will search or what you will type in when you get there, your employer is the School District of North Fond du Lac. Please enter your full legal name, so whatever is on like your medical ID card, whatever is going to match the eligibility file, and there might be some personal information questions. But again, you can go on there as of this minute and start searching for your providers. The other main concern was switching primary care providers. If you have a primary care relationship today, you will be able to continue that primary care relationship into next year, and you will qualify for Garner regardless of whether they are a Garner approved doctor. Okay, so we are not going to ask anybody to change their current primary care relationship. Now, a couple of caveats around that. One, you have to have a relationship before the beginning of the year. So if you don't have a relationship, you can't just pick anybody starting January 1st. Okay, so you would have to already have a relationship established for that to carry over. Second, the qualifying providers fall into a specific bucket. So pediatricians, gynecologists, therapists, psychologists, psychiatrists, obviously normal primary care physicians, those are all going to qualify. If you are seeing a provider for a specialty, and specialists, I always explain it as anybody who ends an ologist generally, so cardiologist, oncologist, that would not qualify unless they meet the continuity of care, which I'm going to talk about in just a moment. But so for general primary care, again, pediatricians, gynecologists, normal kind of routine stuff, that will carry over and that will apply to the Garner program. Specialists are excluded, so you would still need to do your due diligence on the specialist aspect, unless continuity of care would apply. And for continuity of care, these are going to be more serious type medical conditions. So I'm going to read the screen here because I want to get the language right. In a small set of medically intense situations, if a member's doctor is not a top provider, they may qualify for the Garner benefit if the member received care from them before they became eligible for Garner and until a safe transfer of care can be arranged. So some qualifying situations: active cancer treatment, or recent and upcoming transplant surgeries. So again, this is much more the very serious medical type conditions. Non-qualifying situations would be stable chronic conditions, routine wellness care, including with specialists, or newly scheduled electives. Okay, so it is a rather specific type of subset of care that would be continuing. Yes?
So like, you said it will carry over for a PCP. For how long? Like, are we gonna eventually have to switch?
No. This is really small, and again, we'll make sure that all this data gets out. But the question was, how long is this primary care exception going to go on? Are we eventually going to have to switch? And that answer is no. So this walks through, again, the different types of primary care providers. Again, it's important to know that you have to have the relationship today. You still need to go into the app and add them as one of your providers, okay, before you have a visit. Please do not try and do it after you have your visit, because that will not qualify. So if I know, like for example, you know you have a primary care office visit coming up the first week in January, before you go to that visit, you need to log into the Garner app, get all set up, log in, create your password, all that good stuff. You need to select your provider. And then if your provider does not have a top provider badge, you must click request approval on the provider's profile and follow those steps. And then in order to verify that that doctor is approved, go to the settings on the home screen in the app and click the approved providers to view your list. And then every time you log onto the app, once that provider is approved, whether it's a new relationship or an existing one, anytime you see that provider, it will be covered under the Garner program. But you have to do that before your visit. Any questions on that? And again, these instructions will be sent out. Yes?
What if your provider's not on the list? Like if you search for, like, my provider, if I search for her and she doesn't come up, that's
Is she a nurse practitioner by chance? that has been a problem. So if you're searching for a nurse practitioner, if you can get those names to Kim in the district office and have Kim send them to us, we'll work with Garner to get those built in. But yeah, if you are seeing a nurse practitioner, we have found that to be a little bit tricky. So if that is the case, send them to us and we'll work with Garner to see what we can do there. Yes.
So what if you don't have a doctor at this time?
So then you will use the Garner app and then find a doctor through the app and then look for one of the top providers in that app.
So do you go find providers?
Yes.
When you do that, put in the zip code, nothing pulls up.
So, sorry, giggles in the back. I guess I would have to maybe take that away from Garner. I don't know why it wouldn't show up. So
Yeah.
you should be able to search for providers, and if it's not popping up, maybe we'll take that as a takeaway. Is anybody else having that issue?
I think you have to pick your primary or pediatrician, just select that first.
Okay. Maria, did you say you were playing with the app a little bit? Have any problems?
No, I did. Well, I'll be one of those that'll be giving you my nurse practitioner
Okay.
name, but one of my other physicians not right up.
Okay.
So
Good. Yeah.
I know, like the primary care, or not the primary care, but the pre-conditioned one.
Mm-hmm.
I know sometimes you might see a doctor, then the next step, 6 months update, I might then see the nurse practitioner. Would I still need to get her name put in, even though it's still under the doctor's name?
You shouldn't. The question to ask the doctor's office is it's still going to be billed under the physician's like tax ID, because then it'll just flow right through UMR and right to Garner. But if they have like separate tax ID, you might want to double check and make sure.
How many can you add?
What's that?
How many names can you add?
Unlimited. Yeah.
So Alex, once they're linked for good. You don't have to go back in for every appointment.
Yes, you will not have to go in and add them for the claims to flow from UMR. And again, we've set it up so that UMR will be sharing claims file feeds with Garner, so that you should not have to do anything to get reimbursement. It should just flow automatically. What I would tell you, and I believe I mentioned this in September, is these provider lists for top providers do change from time to time based on claims data. So it's always important, if I have a visit and I'm seeing a top provider today and maybe I don't see him again until next year or even 6 months from now, I would still go on the app, verify that they're still a top provider, because if they, for whatever reason, aren't, you would lose that kind of that deductible reimbursement.
Does my spouse download the Garner app, or do I like have all the doctors click on the insurance first?
The question was, do I need to also download it for my spouse, or can I just do it? I'm going to give you two different answers, and I gave the same answer in September. There's a legal answer, and then there's the reality answer. The legal answer is your spouse, as an adult, should download the app, create their own profile because of HIPAA and everything else. I know that's not how this works, but you do need to create a separate profile for him or them. And then you can control their passwords and you can log in on their behalf. Again, that's probably not the most legally appropriate answer, but I know how families work.
So I'm assuming that's the same if you have adult children.
Same if you have adult children, yes. Any minor children, they would just flow under, make sure you add them, but it should just flow under your profile, whoever the account holder is. Yes?
I was speaking with my primary care provider, just asking her if she had heard of this, and she's from Freighter.
Mm-hmm.
And she had shared with me, she was speaking to upper management, who said that they don't pay into this, so their providers are not ranked in that top 20%. Is that correct? Like the actual hospital has to pay in to be on there?
No.
Okay.
So they're not getting their data directly from the hospitals. They're getting it from Medicare, Medicaid, Anthem, United Healthcare, other sources. So Garner does not work directly with provider systems. So yeah, again, because otherwise you run the risk of conflict of interest, right? If one provider system is paying Garner and another isn't, well, that doesn't take a rocket science to figure out where Garner would potentially. So it's all third-party verified sources. So yeah, another complaint I heard from a provider system, it wasn't Freighter, but another was, they didn't like this program. And it's like, well, maybe because they were one of the underperforming hospital systems. I wouldn't like it either if I was losing patient share to it. So, but no, they're not paying Garner directly.
And this is just based on the top providers that are currently accepting patients, right?
Correct, yes. So you should only see providers that are accepting new patients, especially if you're searching. So another thing to remember though is if you're looking for a current provider, they may not pop up in your initial search because they may not be accepting new patients. If that's the case, please reach out to the concierge through the app and ask them to verify your provider, and you will get an answer. But that's an important point because if my doctor is not accepting new patients, they may not pop up on the initial search. That does not mean that they're not one of the top providers. Okay. I had another thought, but it's gone. Any other questions on the Garner piece? Okay. Again, you can find doctors by searching by doctor's name or symptom, and the doctors with the little top provider badge would qualify for reimbursements. Create your list so you can select lists, and then on this list they've got at least 4 doctors listed. I think you can have more, and it can be different based on specialty or just general practice. And then check your list. Make sure your doctor is added in the approved providers tab before you go and see them. Costs from approved providers qualify for reimbursement after they are added to your list. So if you do not add them to your list, it's not going to count. So that's a big thing to remember. You can visit the Your Benefit tab to view your plan details. So it'll show you what the total benefit is, when your plan renews, who's covered, and how much reimbursement you've received year to date. Yes?
Well, just for a mammogram, for colonoscopy, we search by that procedure. Can we tell us where we need to go?
Yes, or you could search by your doctor's name
So
or
we
the
go
facility.
with our primary then, and then it would be covered because that was ordered by them?
Correct. Now, also with your primary care, and we got to be careful here because this can get a little tricky. You can go anywhere you'd like for your annual physical. That should be covered at 100% under the plan anyway. That's an Affordable Care Act mandate. And that should be the same today. So if you go just for your routine annual physical, that would include mammograms, colonoscopies, pap smears, your normal things. The big caveat to that is if you've had maybe any sort of, I'll use colonoscopies as an example, if you've had polyps in the past and maybe your doctor is ordering the tests more regularly, if your doctor's office orders any of those labs or tests as a diagnostic exam, you will be charged deductible and co-insurance for it. Okay? If it's preventative, it's covered at 100%. So preventative, free, regardless of whether you use Garner or not. Diagnostic will apply to your deductible and co-insurance. If it's through Garner, we would obviously reimburse the deductible, but your co-insurance charges may apply. So for things like colonoscopies, mammograms, it's really important to ask your doctor if they're ordering it as just a set of preventative tests, free. If they're ordering it because they're concerned about something, it would be diagnostic and they would charge for it. On the last topic on colonoscopies, that was a big thing with Cologuard. I know it's a way less invasive test for colonoscopies, and it will be covered free if your doctor orders it. However, what we found is if people have had something pop up in that test, your doctor is still going to order a colonoscopy to be sure, and now that colonoscopy is going to be diagnostic and you're going to be charged for it. I have not had a colonoscopy. I heard they're not the most fun, but it may be easier if you're due for one just to get a colonoscopy, get it over with. Because if you do the Cologuard, yeah, it's easier, but if they catch something, they're still going to order the colonoscopy and now you're going to pay for it. So some tips and tricks there. On for Garner's concierge team. They are available. You can chat with them through the app. That's likely the easiest. They also have phone numbers where you can contact someone. I'm not sure if they have emails. I'm sure it's in the help section in the app itself. But really, if you have questions, if you want to add a provider that you're not seeing, I remember my thought from earlier. It is sometimes common for doctors to practice in more than one setting. So maybe they're in one setting in one city one day, and the next day they're in a different city. I know my wife's OBGYN was like that. She was in New Berlin half the week, in downtown Milwaukee the other half. They may pop up under a different building code. So just that, you just need to add that provider. It doesn't matter which building you're seeing them in, but please note, you might search for your provider and it might have a different address than you're used to. Just double check to make sure that's the same doctor. But if it is, you should be good to go there. That was the other thing I wanted to bring up. So here's just a quick snapshot of Garner in action. Sarah created her Garner account during open enrollment. She searched for her current doctor in the app. Good news, her doctor is a top provider. Out-of-pocket costs from this provider qualify for reimbursement. She visited her primary care doctor. Costs for her copay and lab work qualify for reimbursement. Sarah's injured her ankle playing soccer. She contacted the concierge to ask for help to find a top provider who had availability to see her right away. She saw a top provider specializing in orthopedics. Her out-of-pockets would also qualify for reimbursement. So just a little narrative on how the program works. Another big reminder is if you do see a top provider, any prescriptions that come out of that visit are also covered in the reimbursement. So all of those RX copays would be covered if those are covered under a Garner doctor.
Good question.
Yeah.
Is the reimbursement reflected in any way on our EOBs?
So the question was, is your reimbursement reflected on your EOBs? No. So UMR is not going to change their EOBs. What they will tell you is how much of your deductible you've met through the year. And if you hit your $2,000 individual deductible, you would have no deductible charges for the rest of the year, even if you were reimbursed that full amount through Garner. So UMR is really not going to know the difference. They're just going to know the charge came and that it was paid. Yes. In the back.
Some of us have received a letter saying that our current prescription is not on, like it's not going to be covered under the insurance.
Yeah.
Can you explain, is that, because you were just saying like if you get a prescription from your doctor, it'll be covered. But if you got a letter that says it's not going to be covered anymore, I guess I'm confused.
Yeah, we're going to talk about Smith RX in a moment. But to answer your specific question, it needs to be an approved medication through the health plan, and then your copay would be covered under Garner. And we'll talk about Smith in just a minute. Yep.
Yeah, I was just wondering like how the reimbursement part works.
So it should flow. It should flow seamlessly through UMR. It does take about 6 to 8 weeks. So there is the potential that you could get your bill from the system before you've received the check from Garner. You can do one of two things. One, you can just pay it, and then you can take the check and just deposit it when you get it and kind of pay yourself back. Or if you really truly just want to wait, you can wait. And the hospital or the facility might bug you a little bit. Please note that anything you do with medical billing does not affect your credit, so sometimes they'll get really pushy if the time comes. I always have to tell my wife to relax because it really bothers her when you get collections calling. But just please note that that does not impact your credit score, and you can wait to receive the reimbursement if you'd rather do it that way.
So you don't have to actually manually submit for the reimbursement?
You should not. And I want to stress the should not. The program should flow as long as, because again, we've set it up so that UMR and Garner are speaking to each other. There may be a one-off chance that someone might have to file for a paper reimbursement or do it online, but it really should just flow as long as you follow the steps appropriately. On the FSA, another compliance thing, if you have the flex spending account and you're going to continue to have your flex spending account for next year, please note that you cannot use FSA dollars and HRA reimbursements through Garner. So you can't double dip. So what I would tell all of you is if you're planning on using the Garner app to get your medical services, think about that when you elect an amount for flex. Maybe you only use your flexible spending account for dental, or your kid's gonna need braces, so you're gonna max that sucker out anyway, or whatever it may be. But you cannot use your FSA and HRA. So, one example might be is if I get a $2,000 deductible, or I hit my deductible, and I know I'm gonna get reimbursed with Garner, but I haven't gotten that reimbursement check. So I use the FSA dollars to pay it, and then I pay myself back with the HRA. That's gonna get you into trouble with the IRS, because you've just double dipped on tax-free dollars. Okay, so just be aware of that, and take that into account when electing your flex amounts for next year. Any questions on that? All right. Your out-of-pockets, so Garner, again, will cover your deductible charges and your RX copays that apply, or that come out of a top provider visit. It does not cover your 10% coinsurance, so you still may have actual out-of-pocket. Just be aware of that. It doesn't cover everything. It's your deductible and any RX copays, or office visit copays for that matter. So just be aware. Any questions on Garner before we touch very briefly on Smith RX? Okay. For Smith RX, there's slides that I went through last time. I'm not going to go through them in too much detail. I just have a couple of things that I wanted to mention about Smith, and maybe I'll start first with the question that came in. Some of you may have gone to get a prescription and found out that the medication that you were taking prior to September 1st is no longer excluded. A couple of things. One, for certain classes of medications, you get a handful, I think 3, what we call grace fills. So you will have a transition period where you may be able to get that medication, depending on the type of medication that it is, as you transition to a new medication. The main point I want to stress is that every therapeutic class of medication is covered under this formulary. It just may mean that you need to switch medications. So just because the first medication or a medication you may have been on has been excluded, there is another medication on the formulary that would help with that specific condition. So have a conversation with your doctor. The formulary is available online. Ask if that medication would work for you, and then you can switch over to that new medication. If that medication doesn't work for you, whether you're allergic to an ingredient, whether it just doesn't work, whatever it may be, we can work to get that, that medication approved under the health plan, as long as we can talk to your doctor. And when I say we, Smith RX gets prior authorization from your doctor that yes, Alex tried all of the above, they don't work for him, or he is allergic to an ingredient, whatever it may be, side effects, whatever it may be, Alex needs to take drug X, and then Smith RX will get that approved. If you are having issues with your medications, you can certainly bring them to the district's attention, and they'll get myself and Eric involved. But really what I want to stress is please reach out to Smith RX. They are the experts in this. If they're sending you letters that a medication's been excluded, or that you need to enroll with a specialty pharmacy, or you need to fill out an application to get a patient assistance program approved, please pay attention to any communications that are coming from Smith. And if you have questions, please call them. Again, they are the experts. If you send them to the district, who sends them to us, we're just sending them to Smith as well. So they really, that's what they get paid for. They are the experts. They're there hopefully to help you through. I do know that medications can a lot of times be time sensitive and frustrating. So if you're not getting the answers that you need, or Smith is not responding, please then get us involved, and we can kind of kick them in the metaphorical behind to get what you need. But please start with Smith, because they're going to be able to help you much quicker than Eric or I can. And that was the main thing that I wanted to kind of stress there today. Other questions on Smith or anything pharmacy related, or quite frankly, anything else that we talked about this afternoon? Okay, yeah.
So in network, out of network, is it still like in network by hospital, or is it by provider specific?
On the medical plan?
Yes.
So the medical network itself is not changing. It's remaining with United Healthcare, their Choice Plus network. So, one thing we didn't talk about today is you need to also make sure that the Garner doctor you're searching for is in the Choice Plus network through UMR. UMR has an extremely broad network. I think the district's in-network utilization is over 99%. So odds are the doctor will be in that network. We don't exclude any facilities, but there is a chance that a certain specialty provider may not be in the network. So it's always good to double check that. A couple of housekeeping items then, and then Eric and I will stick around for any maybe individual questions. There is going to be a form going out that you will need to complete and get back to Kim in the district office. We are doing an active open enrollment, so you will need to enroll in the benefits in order to keep them. So watch for that in the coming days. And then second, we are also updating the benefit guide. So it's like a 20-page packet with all of this lovely information that I'm sure you're all dying to read. That was a joke. But we'll get that out to you. In that will be the new monthly contribution amounts, other benefit information, some compliance things, how to contact us and the other vendors in case questions arise. But that will also be going out with that form. So again, just remember to get your elections in. Open enrollment will be ending November 8th. So you have a few weeks to get that paperwork in once we get it out to you. But please watch for your emails from the district office as they will be sending that around. And you need to make your elections before November 8th. I also didn't talk about any of the other lines of coverage, dental, vision, etc. Really nothing's changing there. So that's all kind of the status quo for
We will
next year.
start premiums back up for dental in January, though, December for January.
Can you repeat that?
The dental vacation from premiums is going to restart on the mid-December payroll. I think December 15th. I can confirm that in just a moment, but they're taking a pause on dental premiums.
Okay. Everybody hear that?
No.
The dental premium vacation is ending the mid-payroll in December. So the dental contributions for premium will pick back up in the December 15th payroll. Okay. All right. With that, well, I did this last time. I almost excused everybody without asking you, Matt. Anything you want to add?
If there's, again, any other questions that you have, please contact us, the district, Kimberly, Maria, myself. And then if we don't know those answers, we're going back to USI and specialists. But appreciate y'all taking time to be here tonight, doing this work, to understand this. And when the questions come, please know that we're here to help as best we can.
Thank you. We'll go out and enjoy the last of summer here. So thank you.